We're really happy to have you all here in person today, both in this room and the room next door. We've hosted historically numerous meetings and discussions with community partners like you, and we've been looking forward all year to hosting you for this event in particular because we think it's important. And I think we're going to have a lot of great discussion that we walk away with this morning that's going to allow us to really work constructively on this issue of indoor air quality. So air quality has always been a priority issue for Salt Lake City's Department of Sustainability, as well as Mayor Mendenhall for her whole career. And we know it's really important to you, which is why you're all here today. Our work on air quality continues to evolve. And for Salt Lake City's part, for the last 2 years, we've been thinking through how do we continue to push the impact that our air quality work can have. And that goes beyond some of the traditional strategies of mitigating the emissions that go into our ambient air quality and thinking through how do we really protect our residents in their indoor spaces, particularly in light of the sustained wildfire event seasons we've seen in previous summers, as well as the usual inversion phenomenon that we have during the winter time. And so as we've been thinking through the last 2 years of how do we incorporate more air quality, specifically indoor air quality principles into our existing programming and our existing department's work, we started having conversations with all of you and realizing that this was on top of your mind as well. You've been thinking through this. And so that's kind of what created this Indoor Air Quality Summit as being a 2022 priority project for Salt Lake City sustainability and for the mayor. So just to go over a few points of our agenda today, we're going to be hearing from two speakers, Dr. Daniel Mendoza, who's an assistant professor of atmospheric sciences with the University of Utah, and as well as Nick Rice, who's a corporate industrial hygiene manager for Intermountain Healthcare. And they're going to be talking about giving us a lot of insight into monitoring and how we mitigate ambient air quality intruding into some of our public spaces, as well as our homes and commercial spaces as well. And then we're going to have 10 minutes of Q&A with the speakers directly after their presentations. But then we're going to be breaking into some groups for some facilitated discussion so that we can all walk away here with some ideas of how we can collaborate in the future. Those groups will be a policy group. There'll be one for general advocacy and communication. And then we'll have one for what we're calling direct mitigation. And those are folks that actually have a hand in how our facilities and our homes are managed. So with that, firstly, I'm going to hand it off to Mayor Mendenhall, who's going to kick us off for the event. And please say your way, Mayor Mendenhall.
Thanks, Peter. Good morning, everybody. Yeah, thank you for answering. We're not as good at that in the West as other parts of the world, so thank you for answering. I only met one row of the participants here this morning, and it's already a really diverse group. You know that my background and passion is in air quality and environmental science, and thank you. I can tell you that in my 15 years of having these conversations, that we have come a long way. And even the diversity of the people in the room right now is evidence of that. When we started, we were having moral and heartstring conversations in order to try to affect policy. Think about the kids who can't go outside for recess. Think about the people with COPD or other heart-lung conditions who are affected by our air quality. And it was partially because we didn't yet have the local data that could help us make not only greater local health cases, but also really strong economic impact cases. And in a state like ours with a supermajority Republican legislature, I found early on that my heart compelling cases only went so far in affecting policy. But once we could start to make these economic impact conversations, the other reasons that I thought were paramount ended up getting more traction. So I want to thank Dr. Mendoza for being a part of the creation of local data that has helped to drive us, and my friend Corbin Anderson with Salt Lake County, and many others in the room who have helped us to make that local case totally obvious and abundantly supported. Air quality remains really at the top of concerns generally for Salt Lake County residents and certainly Salt Lakers. And therefore, city government has come a long way with many administrations. So my administration is really working to put the pedal to the metal even more so, building on the shoulders of previous mayoral administrations. Uniquely, and something that kind of got lost in the early pandemic is, as you probably know, legislation that enabled municipalities in Utah to get to 100% renewable energy with the partnership of Rocky Mountain Power. We call it the Community Renewable Energy Project. And that is well underway. It will be, at this point, the pay structure and the proposals that will go to the Public Service Commission are coming together. We hope to bring that to the PSC in early '23. And this means that every 7-Eleven, every apartment, every historic home, school, police department, library, doesn't matter, would be switched to 100% renewable energy, not as an opt-in, but hopefully as an opt-out program. That it will be so symmetrically affordable to our existing power rate structure that hopefully no one will have any reason to switch out unless they just really love coal-fired power and they want to try to continue to support that. So this is an exciting advancement that years ago I thought I may have to light my proverbial hair on fire in order to get this kind of a relationship worked out with Rocky Mountain Power. But thanks to Salt Lake City Sustainability Team and many others, we now have 16 other organizations in this state, counties, cities, who are in this partnership together. And Salt Lake City's locked in. So this is happening for us. I could go on and on. I just want to mention a couple of other big steps forward. Public transportation. And when in 2018, I was on the council, we raised the sales tax in order to buy up bus service for Salt Lakers, trying to connect our west and east sides, put the ribs on that spine of rail infrastructure. And so we invest over $8 million a year in UTA to buy up direct service, which means we tell them where the buses go and how often they run. They need to run at least every 15 minutes or faster so that you never have to check a schedule. 7 days a week they run. And we are continuing, as our city grows and our sales tax grows, to invest in more phases of that. So the 6th North and 10th North route is about to come online. In addition, we just had the council approve my request to fund bus passes for every K through 12 student in the city. So this was not the majority of our students in the district, only certain schools, which Greg could tell you which ones, but mostly high schools had bus passes. And I know from the long, hard days of trying to convince existing drivers to be idle-free that even though it's a long game, you're a lot better. You're probably going to net a better return if you compel kids who are not yet drivers that being idle-free is the way to go. We are converting future transit users for life by getting our K through 12 population onto the bus. And in addition to that, we're in a cost of living crisis across this nation, certainly feeling it here in Salt Lake City. And we know that households spend an average of 20% of their whole income on transportation costs. So when we can help families keep that car parked or maybe not have to get an additional vehicle because it's so convenient and affordable to use public transit, we're helping make life better, not just with the air we breathe, but more livable. Come on in, welcome. Okay, I totally went off script, but we know that buildings and homes are a critical space for indoor and outdoor air quality because our buildings produce actually a significant portion of the air we breathe outside. And I think that the COVID-19 pandemic has really helped illustrate, we're lucky to have Nick Rice talking to the group today, how critical indoor air quality is as well. And I don't think I guess we could chalk it up to a silver lining of lessons learned through the pandemic that we get to focus with more intention and momentum around indoor air quality, not only in our hospital and healthcare spaces, but in our schools and in our homes. Thank you, especially to our speakers, again, to Dr. Mendoza and to Nick Rice for making the time, but also thanks to each of you for coming together in person. Nice to see you again, and to helping advance the conversation. Many of us are already well in alignment for 100% renewable by 2030 with your own organizations, for our carbon neutral by 2040, and investing in things like public transit for employees and for those that we serve. So it actually becomes easier and easier for us to braid the momentum of our organizations or simply our own personal interest, as it was when I started trying to participate in these conversations without an organization yet, braiding that momentum together so that we create a continuous and a symbiotic, really supportive environment from schools to work to city government and beyond into our homes. So thank you for being here to have the conversation with us today, and good luck. Take a deep breath. Thank you.
Yeah, thank you, Mayor, for getting us started this morning. So I'd like to go ahead and invite Dr. Mendoza, and he's going to talk through how our poor ambient air quality kind of infiltrates into our indoor spaces. So Dr. Mendoza, I'll let you have the floor.
Thank you, Peter, for the invitation. Thank you, Mayor, for really setting the frame for this conversation. Thank you all for being here in person. It's really nice to see some friends that I haven't seen in several years, actually. So I will discuss today the efficacy of air handling units to reduce PM 2.5. That's the contaminant that we have already published work on. However, we are looking at other contaminants as well. This is a joint project along with Professor Tabitha Benny and Sarah Ball, formerly of the DFCM. She no longer works there. However, she was a key member of this team. So this just shows you something that we unfortunately are too familiar with, which are our wintertime inversions. So this is the view from the WBB building, which is where atmospheric sciences is housed at the University of Utah. As Peter mentioned, I'm a professor in atmospheric sciences. I also have a joint appointment in internal medicine, the pulmonary division at the University of Utah, and I'm also a professor of city and metropolitan planning. This happened this past January, as you can see. I really actually like being in person because I can actually ask this question. As a quick show of hands, how many months do you think this took? 1 month? 2 months? 3? 4? Great, it's 3. So 3 was the number. And so I basically had changed this right around October. And that's how long it takes for filters to go from new to, as you can see, very soiled. I live close to the university. I would have been remiss if I had not used my expertise in atmospheric sciences to pick one of the cleanest spots in the city. I have asthma, and so when I decided on a house to live, I wanted to make sure that I could breathe the cleanest air possible. This is a Hepa filter. Not many people, again, have the ability or the knowledge to know the specific filter which you need to buy. And there are many of our community members who live in much more contaminated areas. So now we have to start to think about what is the majority of our city breathing. This would be in someone's lungs. This would be in a kid's lungs. This could be in an elderly person's lungs, someone who has some lung condition. So we need to start thinking about, right now, everyone here knows about air pollution. Right now here, everyone speaks English. So we are fortunate in the fact that we have the luxury, the ability to learn more about this. We have the time to educate ourselves, and we have the resources to better protect ourselves. So we need to consider not just us, but our fellow neighbors. This is why my work centers around developing equitable and inclusive environments. We first start with a model of environmental exposure, whether this is measured, and I will talk about those measurement platforms, or it's modeled work that we do. For today's discussion, we'll talk about air pollution. However, I do work in the what we call the environmental exposome, which also includes light pollution, sound pollution, water contamination, as well as food accessibility. Then we take a look at what are the health impacts. So as Mayor Mendenhall brought up, we already know enough about what the negative impacts on health are from air pollution, but that's not necessarily the only factor that will drive the needle. We need to discuss the economic impact. What is the cost? And that is what our team can actually do. We do have economists on our team who can then assess, do cost-benefit analysis. Then we start to design public policy, but enactable and realistic public policy. I never go out and say, let's clean up all our air and have zero pollution. That is virtually impossible, because not only is it economically unfeasible given the technology that we have available, but we also cannot take care of things such as wildfires, dust event immediately. However, we can propose things such as, what if we reduce vehicle pollution by 10% or point source pollution by 25%? What would be the cost and what would be the gains in terms of health or other other potential benefits? And then finally, we come up with urban planning. Now, urban planning is a catch-all term for example, redesigning roads. I serve in the Transportation Advisory Board for the city. So some of the decisions that we make, such as lowering speed limits, moving the direction of traffic, et cetera, and even transit. We work, UTA has a member there, and then we learn about the new routes. We learn about how can we mitigate traffic, personal vehicle traffic, through improved routing by UTA. And so then there's a feedback loop. So that's how we actually do develop these policies and how our research is guided, because we no longer, within my team, we want to find out what the needs of the community are so we can develop research that will actually be useful. We don't want to just throw solutions down and then say, well, these can be implemented when we are not very sure that they're realistic. That's where it all ended. But then we saw something that everyone felt in 2020, and now we look at everything through the lens of equity. It's no longer viable or really humane to think about, well, let's improve my neighborhood because I'm able to attend meetings, I'm able to talk to my council member, or I have connections, and we should definitely improve my neighborhood. We need to make sure that everyone benefits equally, and especially we focus on our most vulnerable populations that have historically been marginalized and not been part of the conversation. So let's discuss our air quality observation network. As we know, the Division of Air Quality has stationary sensors. Those are the research grade sensors that drive policy. And we also have added, the University of Utah also manages stationary sensors across the county. However, what really broke ground, what really made Salt Lake City the best studied city in the world for air pollution is in 2014, the University of Utah started a project where we had mounted air pollution sensors, PM 2.5, so fine particulate matter, as well as ozone on tracks trains. Now, fast forward to 2018, this project was formalized and it has been funded by the Utah State Legislature. Now we have air quality sensors on 3 tracks trains. And then this past October, this past fall, we started installing air quality sensors now on the electric buses. We needed to wait until we had electric buses, otherwise the signal from the exhaust of the actual bus would just overtake the entire signal for what we're measuring. This is a collaboration between the city, the county, UTA, Division of Air Quality, the University of Utah, and we're also now working with HEAL Utah. That is one of our partners. Now, what is important is that we chose routes that measure pollution on the west side. We're taking the 509 bus, which goes across Glendale, Poplar Grove, and West Valley as well. We also take the number 2 bus, which goes on 200 South. Why do we do that? Because now we can look at an east to west gradient. Now, This is a real-time shot. This is public data, so we can actually really take a look at where so you can, if you take tracks or you're familiar with the route, you can see that it's going, the one that's going vertically north-south, that's the blue line, and then the one that's going diagonal southwest, that's the red line, and then the 509 bus is going sort of from the north side of the county. You can see how we can, this gets refreshed every 5 minutes. However, a really great project with Salt Lake City, and I actually just saw the prototype yesterday, is now we can actually create a heat map. So now we can see what the air quality is in every part of the county. Why that's important is because, say for example, you want to decide, you have the ability to choose, do you want to go for a run at Liberty Park or at Pioneer Park, which one has better air pollution? However, what is really important to me is working with the school districts and then trying to look at RESA's guidance. I also serve on the asthma task force from the Utah Department of Health, where part of what we've been working on is looking at RESA's guidance and what the air pollution is, and in terms of allowing kids to go outside. This was the fireworks from 2019, and this is something that we can actually see very clearly, where right before the fireworks started, we had green air quality. By the way, this is all color-coded by the air quality index colors that we're all very familiar with: green, orange, red, yellow, etc. Now we can see where in Jordan Park, International Peace Gardens, when the fireworks first start, we see that hot spot, but then that spreads throughout the entire city. You might be wondering what's going on the east side, and that is where Emigration Canyon is starting to, during the evenings, we have a cold pool of air that comes down from the canyons, and that cleans up the east side. However, you can see that all that pollution actually gets shoved and lingers there on the west side. So, you came here to talk about indoor air pollution, but I wanted to give a background of how we're measuring outdoor pollution so we can provide a framework. So, indoor air quality is related to outdoor air quality. It's not the only determinant, and I will walk you through that in the next couple of minutes so you can see that. And I'm looking at really office buildings, schools, and homes. Those are three larger groups of buildings that I've been studying because they have very different characteristics. Since we spend about 90% of our time indoors, it is paramount for us to really be most concerned about the pollution exposure that we receive while we're inside a building, whether it's our home or a commercial building. So this is really the manuscript that it's the first of its kind where we've used research-grade sensors. We specifically use research-grade sensors, which are very different from the low-cost sensors many of you might be familiar with. The reason for that is the research-grade sensors are robust, and they are able to really provide us with policy and health solutions. So this was done, as I mentioned, with Sarah Bowl. And we had our study site was the Unified State Laboratories in Taylorsville. And the arrows point to some of the sources. So we have large highways, we have the mall, for example. And so we wanted to really capture what is going on, what is entering a building. Now, don't get too caught up in this. These are just a different, what we call Merv ratings. Those are the different types of filters that we can put in different buildings, and those help. And then you can kind of just quickly see what particles will be trapped and at what efficiency. Just to give you an idea, so for most homes, whenever we go to a hardware store and just get the cheapest filter, that's probably anywhere between a 3 to a 5. We call those in the industry rocks and logs. That's basically all they trap. We really want to be looking at something along the lines of a 10 to a 13. Now, don't go home and then buy the most, the highest rating Merv, because again, if you think about it, what it does is it actually tries to filter the air pollution. And if it's too high and your furnace is not equipped for that, then it will just fail. So if you do want to go home, if you get this takeaway and say, wow, I don't really want to be breathing the stuff that was being filtered, then contact the HVAC people, basically, that are in charge of your furnace, and they will give you a really good idea of what you can put. Then when you start to look into the green there and the Merv 17 and up, that's, I think, where we'll be hearing more from Nick about what hospitals really have in terms of, especially as they're going down deeper, as I call it, into hospitals where you're looking at the operating rooms where the air has to be pretty much as sanitized as possible. I'm not going to bore you with that one, but this one is actually a really good example of the indoor versus outdoor air quality. We looked at over a year and a half of data, and what I wanted to highlight were some of the most important events. So we have, for example, an inversion there. That's what we all are generally very concerned about, but that's because we're visual creatures. So we see the PM 2.5 outside and we think, wow, this is a real big problem. However, indoors, we're very well protected. And it's not because the building is specifically really protecting us through filtration. It's simply because outside, as you may know, I don't know if you've heard the terms primary and secondary, but primary PM 2.5 is what comes out of a tailpipe, comes out of a factory. Secondary is formed because when the air is trapped, now chemicals have time to meet each other and then create PM 2.5. Now, remember, during our inversions, we have higher levels of humidity, and it's cold because it's winter. When the air goes inside the building, that's a completely different environment. It is warmer and it's drier, so that PM 2.5 just associates. Those stable environmental conditions that were there for it to be formed no longer exist. So these buildings were not necessarily filtering as much. It was mainly just changing the environment. That is not the case with wildfires. We can see here with wildfires that, and by the way, the red and purple lines are essentially the outdoor sensor, and the black line is the indoor sensor. We can see that about 80% of the outside PM 2.5 does not go inside during inversions. However, during wildfires, about 80% goes inside. Why? Because those smoke particles, not only are they smaller in general, but they also are, we like to call them real particles. They are going to be stable regardless of the environment. So as soon as they go inside the building, it doesn't really matter that the environment change. It still gets through the filtration and goes inside the building. Fireworks are really interesting because they have a little bit of both. So there's actual smoke, but there's also this chemical reactions that happen, again, because in opposite to inversions, it's very hot while the fireworks are going on, but as soon as they go inside the building, it's relatively colder. There's air conditioning, and of course, it's not an active fire. So we see a little bit of both. But now look at I want you to take a look at the scale of the fireworks, especially the 4th of July, which thankfully we no longer have fireworks in the city, so that's something we definitely appreciate. You can see that those horizontal lines give you the air quality levels. And you might have heard of red air quality, but the next level up is purple air quality, and that is significantly worse. It's 3 times worse than red air quality. And some of the work that we're trying to do is start to do some predictive medicine work in terms of understanding what patients are nearby some of these events to see what their likelihood is that they may need hospitalization and visiting to urgent care or emergency room, unfortunately. And then finally, we have a private fireworks event, which again, while much smaller, it's still and much shorter in duration compared to weeks, for example, of an inversion or days of a wildfire, still much higher than either of those 2 events. So what I'd like to show here is some of the work that we've done on air quality and educational outcomes. This is very important because now we're actually putting the rubber to the road. We've done studies across schools, across all of Salt Lake County, where we looked at the effects of particulate matter on 3rd grade students' proficiency in math and English language arts. What's great about having standardized tests is that now we know everyone's taking the same test. And what we did find is unequivocally, students do worse following poor quality events. And this is normalizing, what we call normalizing, which means taking into account what their income levels are, what their race are, etc. That does not play a role because we, again, looked at over 200 schools. And then this is the project that I did during my pulmonary fellowship where I looked at the impact of particulate matter on absenteeism. I think this is what the slide that's actually potentially more important to take to stakeholders, where we looked at the economic impact of air pollution on school children and their absenteeism. So there are three impacted groups. Schools in Utah invest about $40 per day per student. So when a student is absent, those $40 are not being spent on the education of a student. Back when the study was done in 2018 or 2019, the average wage was around $23 an hour. Imagine that a child is sick, so generally at least one parent has to stay home. So that family immediately loses about $200 in terms of income. And 56% of students, now it's closer to 65% of students in the Salt Lake City School District depend on free and reduced meals, had a very low estimate of $5 a day. That would be the cost for the family to feed the student who would otherwise be receiving that breakfast or lunch. So already the family is down $205. The school has not invested those $40 in education, but the real large number is the economic multiplier. The economic multiplier just basically means what is the impact on the greater economy due to wage. I'll give you a really quick example. Let's say you need some work done on your home, and then you get quoted $10,000 by the person who will be doing that work. Well, only about $4,000 of those dollars go directly to that person towards wages. The other $6,000 go towards transportation, equipment, taxes, etc. So really the impact on the greater economy is about 2.5 times your salary. And that's actually a low estimate. We could have ranged it anywhere between 2.5 to 4. That's accepted value in the literature. So the estimated impact just in the Salt Lake City School District of air pollution is close to $450,000 a year. This actually was taken to the Utah State Legislature, and in 2019 I worked with Representative Wheatley, along with Senator Escamilla and Representative Romero, and Representative Handy, who've been working with air pollution impacts for a long time. And actually, Representative Wheatley ran the bill that now every single school in Utah has emergency asthma inhalers. Just like we have EpiPens, now every school has that. Why does that matter? Because many times during recess, for example, during an inversion, kids would go outside, they would play, they would get an asthma attack, and they would either have to be taken home or be taken to a hospital, and they would miss that half of school. This is actually a very important environmental justice issue as well, and social justice issue, because many kids from low-income families may not have been able to afford any kind of asthma medication. I take several asthma medication a day. Luckily, I am able to afford that, and I have not had asthma attacks. But if I did not have that medicine, the rescue inhaler would be pretty much the only difference between me being a productive person and not a productive person. So this is very important, especially for those low-income families. And what we then follow up that work with, and again, we have several of the co-authors here, Corbin Anderson from the Salt Lake County Health Department, and we are working with the Salt Lake County Health Department on many more of these deployments to look at indoor and outdoor air pollution. We looked at the particulate matter inside and outside 2 schools in Salt Lake City, and we looked at both East and West High. What I'd like to just more highlight here is the diurnal cycle. We can really see, and I don't want to really bore you with too many of these graphs, but we can really see the difference in outdoor pollution. The outdoor lines are the green and the black, and East High has substantially less PM 2.5 pollution outside. And however, when we take a look at the inside air pollution, this is just a time series, we can see this was an inversion event that at least thankfully both schools are protective enough that the indoor values are essentially the same. So the filtration, if you remember back to that slide, those schools had they now have Merv 13 rating, which is fairly high for a commercial building. So those schools are protecting the students equally well. What we did find, and I think this is more important to you as an audience, is what we wanted to look at is how long does it take for that pollution outside to manifest itself inside. And what we did was we basically lagged, which means that we took the values, and this is minute resolution data. We just delayed the outside to the inside to try to match up. And what we found out in the end is that it takes about 57 minutes for the outdoor pollution to move inside, to find its way inside the building. We also looked at a dust storm. There was a dust event in April. And you can actually really see this is much more clear, where you can see the little peaks there on the red line following the peaks outside. And that, because the dust particles, we suspect the dust particles are a little bit larger, that takes a little bit longer. It takes about 73 minutes for that particle, for the larger particles from the outside to find its way inside. In terms of ozone, and this preliminary, so please don't quote me on this yet, we're getting ready to publish that manuscript. It takes about 15 minutes for ozone. Why do we think that? It's because it's a gas. It can move much faster. It doesn't really get filtered out as well. And I'll discuss the last set of buildings, or the homes. I've been working with a pilot project with Salt Lake County with this collaboration with the Green and Healthy Homes Initiative. And we're looking at pre, during, and post-intervention readings. And we've already looked at several homes. What we can see is that when we're looking at outdoor and indoor PM 2.5, I don't know if you remember back in 2021, right around this month, on August 6th, there was a substantial dust event, and there was also a wildfire event. When we combined those, again, we saw that the outside readings are fairly high, and then a large amount of that actually made its way inside. I do remember that we discussed with the Utah Athletics Department. Football practices were canceled that day for the safety of the athletes, and I know that other schools also did the same. Ozone, homes are very protective. We don't see very much ozone really filtering its way inside the home. However, the red lines here, as you've seen in the previous slides, is the indoor. We saw that one of the homes there had substantial indoor air pollution issues. So if we're looking sort of at the scale of office buildings, for example, where the majority of the indoor air pollution really has a large determinant is the outside air pollution, because inside there's not a lot going on. We then start moving to schools where kids are, for example, tracking in dust. There might be a cafeteria that's causing indoor air pollution. Homes, I mean, you can have people smoking, you can have pets, you can have hairspray, you can have cooking. So we definitely need to be looking at this as very different building categories. Many collaborators and contributors. This is a substantially large team, and this couldn't be done without the help of all these individuals. And so, thank you.
Thanks, Dr. Mendoza. And we'll have some time for Q&A after our next speaker. So thanks very much. Next up, we have Nick Rice. He's mentioned the Corporate Industrial Hygiene Manager for Intermountain Healthcare in Salt Lake City, and has over 20 years of experience in environmental health and exposure science. He is board certified industrial hygienist and certified safety professional with a bachelor's degree in public health, industrial hygiene from Utah State University, and a Master of Science in occupational health, industrial hygiene from the University of Utah School of Medicine. So come on up and you can have the floor.
It's a real honor to be speaking to this this group of air quality champions. So thank you for having me. While I'm getting set up here, I'll tell a little story. I was able to drive here today in an electric vehicle that was purchased through the Utah Clean Energy eDrive program. That was collaboration with Holo Zoo at the time. I believe you received some funding from UCARE. I was able to charge that car with solar panels on my house that were procured through community purchasing program, again through Utah Clean Energy. When I got here, I was able to park at a city meter for free as an incentive and a benefit from Salt Lake City. So really want to give a thank you to all those governments, nonprofits, and advocacy groups that are making these air quality efforts accessible and feasible. I'm going to talk about some mitigation strategies we can use to mitigate our indoor exposure to outdoor air pollution. trying to take some of that research information that Dr. Mendoza presented and give you some practical strategies that we can implement to improve air quality in our houses. Yep, thanks, Peter. Is that better? Yeah. So, what comes to mind when you or the public thinks of air pollution? We think of industrial sources, traffic-related emissions, wildfire events that are really becoming, happening more frequently and of increasing concern due to climate change issues, drought. It's really quite a regional problem. Here we're seeing wildfires in California, and that smoke in hazardous levels is making its way all the way to Utah. The science is indisputable. We know that exposure to outdoor PM 2.5 is associated with adverse health effects, cardiovascular, asthma exacerbation, COPD, increased absenteeism, as Dr. Mendoza mentioned, and ED visits. That is firmly established. If you were to ask me about air pollution, I think about that a little bit differently. I'm thinking about our homes, schools, and the offices and workplaces where we work. Indoor exposure to PM 2.5 particulate matter is much less recognized as an issue, and it's less studied compared to outdoor pollution. However, I'm here to kind of change the way you think about that today. Our homes do provide some attenuation, or they do provide some buffering to that. But in terms of exposure, the vast majority of outdoor pollution, PM 2.5, that we're exposed to, that exposure occurs inside buildings. The average American lives 79 years. We spend 69 of those 79 years in buildings, specifically 54 of those years in homes. Even in Utah, where we love the outdoors, people only spend 6 years of their life outside. There have been studies on our behaviors, and you can see here just under 90% of our time over the life is spent inside. Offices and factories, our workplaces, that's about 5.4%. Less than 8% of our time is spent outdoors. I will mention specifically on residential exposure, about a third of your life is spent in the bedroom. And obviously that's where we're sleeping about 8 hours a day. And that becomes an important factor as we think about where we might target solutions in mitigation to indoor exposure. So outdoor air quality is an indoor air quality issue, and all of this epidemiological research we have associating outdoor air pollution with health effects really applies to indoor exposures, because that's where we spend our time, and that's actually where your exposure is happening to outdoor pollution. So just to take a step back, look at the bigger picture of indoor air quality. There are many sources of PM 2.5 indoors. The largest source is outdoor PM 2.5 that makes its way and infiltrates the building. Second to that is cooking, which is not always intuitive, but heating of fats and oils on stoves, cooking in the ovens can really produce hazardous levels. Granted, it's often for short periods of time to PM 2.5. There's combustion things with candles, burning of fossil fuels, mechanical activities such as the use of ultrasonic humidifiers. Humidity is great for improving indoor air quality and health. It's ideal to have 40 or 50% relative humidity, but if you're using an ultrasonic humidifier that is not, you're not using distilled or deionized water, all those minerals in that water become airborne. Issues with biological exposure, specifically building materials that are wet with mold, and there are complex chemical reactions similar to what Dr. Mendoza mentioned about secondary aerosol generation that happens outside, that happens inside too. Just want to take a step back and briefly mention cooking, because it's to the public not often recognized as much as an issue. Everyone should have an exhausted range hood over your stove, and you should absolutely use that every time you're cooking. You know, observational studies show people use a little bit of judgment. The de facto thing should be turn on your exhaust hood. Another tip to reduce exposure there too is to use your back burners. There's better capture with the hood, and that food is slightly farther away from you. Outside of particulate exposure, there's all kinds of things happening in the indoor environment. We bring lots of materials, furnishings, appliances, processes into buildings, and some of emit a variety of substances. Some are harmful. You have to mention radon, leading cause of lung cancer. It's cheap to measure, and compared to the cost of a home, it's relatively cheap to mitigate. Environmental tobacco smoke, you know, chemicals from cleaning products, building materials, burning of natural gas. If you have natural gas appliances, there can be concerns with carbon monoxide, carbon dioxide, and oxides of nitrogen. So indoor air quality is a very, very large area. But today we're here to talk about outdoor pollutants getting into the indoor environment. And just kind of picking up on the themes that Dr. Mendoza presented, infiltration occurs through a variety of means. We have what we might think of as a building envelope. And there can be cracks, crevices, some very obvious, some not visible to the eye. And you can have infiltration through the building envelope in places that we don't necessarily think about. Also natural ventilation. We have windows, we have doors, we're coming and going into buildings. Outdoor pollution enters that way. In commercial buildings with mechanical ventilation, we bring outside air in, and especially when you have inadequate filtration, that is actually a means for those particles to enter the building. You know, there's a balance here. To dilute all those chemical constituents and odors I talked about earlier, you do need to bring in outside air, but it does need to be in a controlled manner and highly filtered. So now we know how the particles get into the building, how much gets into the building. And there's this concept of infiltration factors. And they're really super, super variable depending on what kind of building and the building characteristics. Dr. Mendoza talked about Unified Public Health Lab, where they've done some of those studies, and there's actually quite a bit of infiltration, even though that is a highly sophisticated building. On average, for PM 2.5, our buildings have an infiltration factor of 0.5. That means they buffer about 50% of the outdoor air. Highly variable, that's what this chart here is attempting to illustrate. It was a study of many studies and hundreds of buildings, but on average, for PM 2.5, our buildings attenuate about half of those particles. Smaller particles, larger particles, on average, attenuated better with this factor of 0.3. So that would be like a 70% reduction, but super variable. Some of the infiltration factors of significance that are going to play into some of the controls I talk about include the building envelope, how weatherized is that building, how are we using windows and doors, and then many of the factors relate to the ventilation system, or HVAC. So building pressurization. Buildings can be slightly positive or slightly negative pressure. So if we exhaust more air out of a building than we put in that's under negative pressure, those fine particles are going to find their way in through cracks and crevices and enter homes, offices, and schools. Filtration, how long are we running the fans associated with our filters? And in commercial buildings, it gets much more complicated with what we call outdoor air economizers, or these systems designed to bring in outside air. The First mitigation strategy, and I'm going to talk about two: filtration, portable HEPA air cleaners, and DIY HEPA air cleaners. The first mitigation strategy for residents and commercial buildings is to upgrade to a MERV 13 filter or the highest filter efficiency feasible for your system. There's been a lot of public knowledge with COVID about filters, and as air quality champions, we need to start speaking this lingo like MERV. What is MERV? You saw a similar chart from Dr. Mendoza, but essentially the higher the number, the higher the efficiency. Default commercial buildings have this MERV 8 filter. For our PM 2.5, that's only providing about 20% filtration. Moving up to MERV 13, you get 85% filtration. Works better under bigger particles, not as well under smaller particles. So MERV stands for Minimum Efficiency Reporting Value, and it's the national standard. ASHRAE, American Society of Heating, Refrigeration, and Air Conditioning Engineers, that professional society sets these standards. This is another way to look at MERV filtration. These numbers are the MERV filter rating. So you can see here, this is particle size, this is a MERV 8. You move up to a MERV 13, that works much better. However, there's this dip that occurs around 0.1, 0.3 microns, and filters in general, that's the most penetrating particle size, do not work as well there. Interestingly, on average, you get much better performance for ultrafine particles. So, filtration tips for residents, commercial buildings, institutional buildings, maybe a better way, nicer term would be schools. You want to look for MERV 13 filters with a low pressure drop. So we need to move air through there. We don't want to cause an obstruction. That's an important consideration. How often the fan or that runtime is critical. So if you think about your simple home system like is illustrated here, there's that setting off, on, and auto. We all by default have that on auto. So when it's calling for your thermostat heating or cooling, the fan comes on. On average, depending on your climate, that fan's only running 18 to maybe 25% of the time. If you move that to on, you have filtration happening all the time. You do need to consider your filter is going to load that much more and is going to be needed to be changed more frequently. Installation matters. You can have super good filters, but if they are not sealed well into the system, air just bypasses and it doesn't work so well. There's always questions on energy. There is a marginal energy cost for filtration upgrades. There's some caveats into that, but there's a marginal energy cost. There is a more substantial energy cost for running your fan continuously. For those folks that have influence on commercial buildings, schools, and institutional buildings, engineers become critical here. And you need to request during design that your engineer is specifying to ASHRAE 62. Again, this is lingo we all need to become familiar with, but that is the national standard for ventilation for acceptable indoor air quality. In most places, that standard is not code. All the engineers know about it though and use parts and pieces. There's a really interesting part of this standard, and it says you need to consider your attainment status for outdoor air quality, such as your attainment, or in our case, non-attainment status for PM 2.5 and ozone, and the engineer then needs to design for filtration to deal with those contaminants. So there is guidance. We need to be asking our engineers to use that guidance. And equipment replacement. Oftentimes, you have a 30-year-old piece of equipment, it gets upgraded with something more energy efficient, something more reliable. It can be replaced just in kind. That often means the filtration capabilities don't get considered. So that is a great time to say our equipment replacement needs to accommodate MERV 13. So ozone, we have ozone concerns here. You know, what can you do about ozone? activated carbon filtration is effective at ozone. These Merv filters I'm talking about, and these are examples actually from my house, have an option to have activated carbon. At this point, I don't have a lot more to say about that because there's not like a very good national standard about how much carbon is in these filters, how often do you need to change them. But in general, ozone can be mitigated with activated carbon. There's a big caution out with COVID. All these emerging air cleaning technologies are getting marketed. If you see any of these, it's a red flag. Ionization, reactive oxygen. Some of these technologies actually produce ozone, which is a contaminant, right? And some of them produce ions that are very reactive and might not be good for health. So that's a caution. There's a really good positions statement from ASHRAE on this. EPA and CDC have some comments too. So caution if you see air cleaning technology with any of these terms. Mechanical ventilation is a tried and true solution. Mitigation strategy 2. We can use this in commercial, residential, and schools. Portable HEPA filtration. The National Academies of Science, Engineering, and Medicine has recently published a consensus study, just came out like in May, regarding mitigating PM 2.5 in buildings. They have very strong supportive statements for portable HEPA filtration, and I have tried to summarize those here. It's a highly effective tool, and it is much more plug and play than dealing with your furnace and all those concerns about changing filters on time and not overloading filters, etc. So this is a simple strategy and one that's very appealing for residential settings. In that National Academy study, these statements come from. Dr. Mendoza's paper is actually referenced on infiltration of particles into buildings. So for portable HEPA filtration, here's considerations. Prioritize placement in bedrooms. That is based on we spend a third of our life in bedrooms. There is a national test standard for these, CADR, Clean Air Delivery Rate, that tells you how many cubic feet per minute that particular HEPA air cleaner delivers, so you can do an apples to apples comparison when you're shopping for these. They need to be sized to the room that you want to protect. It's recommended that we try to achieve 5 air exchanges of that clean air per hour. And if you are buying a one of these devices that has this rating from the American Home Appliance Manufacturers Association, they have a standardized label and it's going to say, this is effective for a room of X square feet. It assumes an 8-foot ceiling, so if you have big ceilings, you have to compensate or get a bigger unit. Rule of thumb here on how to size those. Portable HEPA filtration, easy to implement, highly effective at reducing PM 2.5 and those associated symptoms and health issues. You got to use these for them to be effective. Noise matters. People turn them off if they are too noisy, so look at the noise levels. And energy, again, is always a concern. Depending on the unit, they can, pull 75 to 175 watts. So think of this in terms of an incandescent bulb. If you ran this 24/7, depending on the size, that could be $6 or $12 a month. So it's not inconsequential. There are Energy Star ratings for these devices. This is just one particular study, and there's lots of them that looked at the effectiveness of portable HEPA filters in homes. On the left is no intervention, kind of what the infiltration factors looked like, and then on the right you can see the significant reduction. In this case, it was 48 to 78% reduction in the outdoor PM 2.5 that penetrated the building. Okay, mitigation strategy 3, DIY portable filters. So those HEPA units at the very low end are $250, $300, and they go way up. got to replace filters. That can be a couple $100 a year. These portable DIY filters really took off in 2020 with COVID, and they are often referred to as the Corsi Rosenthal Box. Dr. Richard Corsi's the Dean of Engineering at UC Davis, premier indoor air quality expert. He came up with the concept. This other person, Rosenthal's kind of a filter guy, and he kind of implemented how to put these together. But essentially, you take 4 2-inch Merv 13 filters that you could buy at Home Depot, Amazon, your local Ace hardware store, a 20-inch box fan, and you tape this all together. These are surprisingly quiet. This is more quiet than the expensive portable HEPA filters I have in my home. The cost to put one of these together is about $100. You do have to replace those filters about $60 every 6 or so months. These have really taken off as a community low-cost strategy that has proved to be highly effective. The clean air delivery rate, that CATR, they're estimated to 500 or 600. So that's better than many of these portable HEPA solutions. So 3 mitigation strategies there: filtration, portable HEPA, and DIY. So for those of us that have influence of commercial and institutional buildings, we should be concerned about what's going on with wildfires. And we want to create environments that are safe, especially schools, especially public buildings. And there's this concept of developing a wildfire smoke readiness plan. And the geeky engineers, ventilation engineers, have a super excellent document on how to do this. And this is something for commercial buildings, and there's kind of 10 steps. Highly technical. This is when you bring in a mechanical engineer and your facilities maintenance group. And there's 10 steps, I won't go through them in detail, and a process. So you go through all of this planning, figure out how you can add supplemental filtration onto your air handler, where you want to have portable HEPA filters, designated places in your building to have these air quality refuges, and you are all ready to go ahead of time. You've looked at building pressurization, done all kinds of planning. Based on state and local air quality alerts, when we start going into orange, red, purple, it gets implemented. Interesting strategy here is ASHRAE calls for the use of a low-cost air quality monitor as a feedback loop to compare your outside to inside to make sure that you have an effective strategy and you can, as you go in real time, make improvements as necessary. So for commercial buildings, this is a very good tool, highly endorsed by the EPA. Way too complicated to communicate all of that to homeowners. We need to make it very simple and provide very simple directions for residents. So we're prepared if we have more of these wildfires that are creating red and sometimes purple, extremely hazardous air quality events. So these are some infographics from the California Air Resource Board. Very straightforward. Check your air quality index. As you're moving up to red and purple, you need to do these things. I'm here to talk about the building strategies. Same thing we talked about, Merv 13 filters. Use portable HEPA filtration. Create areas inside of clean air refuges. Stay inside, close the windows. The second graphic they put out, I really appreciate, they indicate run your AC 24/7, so you're getting those filtration effects from your furnace. Simple, straightforward communication. We don't have to do what California does. We can look to see what Montana does. Montana has been working on this since 2017. Same general guidance. Portable HEPA filtration, upgrade your air conditioning system to use MERV 13, tighten up your house, close the windows. I'm not sure about direction to tell people to cook outdoors where the air quality is bad, but that's what they're doing in Montana. But I really like the simple infographic and communication that can be rolled out in anticipation of wildfires. The Missoula Health Department and a nonprofit in Missoula called Climate Smart Missoula have been deploying DIY portable HEPA filters to at-risk, low-income, homebound seniors, schools, and other individuals in need. This part of Montana is very susceptible to wildfire smoke, but they have figured out how to do this on a community level. I love this person's shirt. It says Missoula Food Bank. They are using that infrastructure to get these simple, affordable air cleaners out to the people that need them. It's been very successful. You have to consider, the filters need to be changed. If you're gifting them, how are these going to work, et cetera. So, kind of in summary, we spend 90% of our lives inside. Our exposure to outdoor air pollutants like PM 2.5 and ozone largely occurs inside. However, we have immense control over the indoor environment and can significantly reduce PM 2.5 exposures. Talked about 3 mitigation strategies: upgrading filtration, portable HEPA filters, DIY HEPA filters. Wildfire smoke events and similar extreme outdoor air quality events can be planned for, and we can have wildfire smoke plans to deal with those. And we should target our mitigation strategies to those most susceptible to wildfire smoke, including older adults, kids, infants, those with chronic cardiovascular or respiratory issues such as asthma. These concepts are endorsed by the National Academy of Science, Engineering, and Medicine. They are not off the wall. EPA and CDC is also supportive of these concepts. These strategies on filtration are also effective for COVID mitigation. So these are achievable science-based goals that we can use to help our communities live the healthiest lives possible. So that's what I've got for you.
Thanks very much, Nick. That was fantastic. And I think you've provided us all with kind of a really great overview of a lot of different scenarios in which we can attempt to kind of start mitigating how we can improve and protect our indoor air quality. So for the next 10 minutes, I want to invite our speakers to take some Q&A from all of you. And so, Nick, you can come on down here. And I don't know, did we lose track of Dr. Mendoza? Oh, there you are. You're way back there. Maybe we'll just have you stand for next few minutes. And feel free to answer some questions. One, actually, though, I just wanted to get started for us. So we have kind of this concept of cooling centers, but I'm curious to know, is there such a thing as a clean air shelter or center that we should be piloting, and who would be kind of the ideal agency or entity to look through that?
That is an awesome conversation for an awesome conversation for our breakout session with our community partners and nonprofits. But yes, there are areas of the country in wildfire season, particularly Montana, that have developed clean air refuges. So places that the community can come to that we know has safe air. I mean, there's challenges. People have to be able to drive there, then you're going back home, do you stay there to sleep? But that is definitely a concept, and one that may be feasible for folks that don't have the money or the resources to implement some of these controls.
So I'm glad that our colleagues from the Salt Lake County Health Department are here, because that's exactly what we're doing right now. We have sensors set up at a community center, the Northwest Community Center in Rose Park, because that's really been one of our concerns. When we're bringing people in, in a cooling center, how is the air quality? What kind of air quality are we bringing them into? And so we have actually started that pilot project. It was right around May when we started, and we've been collecting the data. So that will be one of our upcoming studies because it is a substantial concern, not just PM 2.5, but ozone. As I've mentioned earlier in my presentation, ozone could be coming in, and especially when we're thinking about things such as laser printers, which do emit VOCs, the volatile organic compounds, which are a part of what makes ozone, along with nitrogen oxides. That could be a substantial health hazard. We don't know yet, and that's why we started this pilot project.
So I'm interested in a couple of the nuts and bolts of the air filtration for wildfire mitigation. If you have a system and you put it in your bedroom at night, and then in the main part of the day you're not in your bedroom, do you move it and maybe diminish the air quality in your bedroom when you go to sleep, or do you try and do all your work in your bedroom, or
Yeah, so the question is, if you have that portable air filter in your bedroom where you spend 8 hours sleeping, do you move it? They are portable, so that is possible. I think what happens is people get tired of doing that. And from a behavioral standpoint, I think that's something we need to understand better. More importantly, I think the education needs to be during these extreme wildfire events, that air cleaner is on and it's on high speed and we don't turn it off. But it would be more effective for you either to, set up your office in the bedroom or to move that Hepa filter with you. Alternatively, you can go to the low-cost DIY solution and for $100 get a portable, homemade solution that you can put in your living room or wherever you spend most of your time.
and then with the portable one, does that need to reside in, does it need to be in a window? I mean, typically-
No, in fact, no. And you can get into, where's the most effective place to put this in the room, and usually that's in the center of the room, and we can never do that, right? So move it out a couple feet from a wall.
don't use it.
It is not bringing in outside air. This is a recirculating system, and it's literally plug and play. You plug it into the wall and power it on.
And if you don't have air conditioning, you're.
If you don't have air conditioning, portable HEPA filters or the DIY solutions, plug in the wall.
But I mean, in terms of heat.
Oh, in terms of heat.
Right, if you don't have air conditioning, you're reliant on it.
Yeah, and that is, these fires usually happen in the summer and it is hot, and opening the window brings in a lot of those pollutants. So these cooling centers, might be part of the solution.
Speaking of heat, there's a mixed message about evaporative coolers. They're more energy efficient than central air, so no carbon footprint, household expense. But then when we're talking about outdoor air pollution coming in, it's blasting it in. Does the typical pad have any air filtration problems?
Yeah, so the question's about swamp coolers, evaporative coolers, especially on residential applications. Very poor filtration properties with a typical evaporative cooler. And those of you that have these, or I grew up with this, you have a sense of that. It is possible, if the system's designed right, to add filtration downstream. You don't see that much, but that's technically possible. That might be part of instructions too, that consider turning those off during really, really bad air quality events and using portable filtration. They are energy efficient solutions. In commercial buildings, we can have evaporative direct and indirect cooling systems and still have that filtration, and that occurs. It's more challenging in the home. Yes?
This year we're seeing both the commercial and residential building codes up to be updated. And this, for residential, every 6 years, and commercial every 3 years. Are there programs within there that we should be looking towards or to mitigate?
Yeah, so commercial and residential codes are up. I mean, I'm just repeating the question so others can hear that, are up for renewal, readoption. It is an excellent opportunity to make a big difference, and we should be looking at components. As you know, building codes are difficult in this state particularly to change. However, buildings get built often to those minimum standards. And so when we change those codes in a smart way, that can have a huge impact. And ASHRAE has really good guidance, but it is often not codified. Yes?
Do you know of any communities that have codified those ASHRAE standards?
It has happened specifically with ASHRAE standard 62, and there's a 62.1, which is commercial, and a 62.2, which is residential. I would have to study that. Oftentimes they carve out sections. And the latest version is 2019. It's going, that standard is going over a major overhaul, and you'll see, I think, changes to filtration requirements, et cetera. I'd have to research that, though. I'm happy to take a look.
I had a question, and this is actually more for Daniel, but it kind of relates to building standards. So sometimes building codes, as we mentioned, don't move as quickly as we want, but we can make our own internal policies about how we want buildings managed. So you were working closely with some folks at the state of Utah. Do you know of any sort of policies or internal policies that they've instituted regarding how their facilities manage indoor air quality?
Directly, no. I think that they've taken a lot of our research and really started to understand how they can better manage buildings. We started first with the Unified State Laboratories, which is one of the cleanest buildings. But so far, the needle has not moved yet, as far as I know. And one thing I wanted to add about building codes is, as we're thinking about how can we reduce emissions from the actual sources, we've got to think about the fact that the average car lasts about 5 years. So that's quick turnover. So we can electrify a fleet, for example, fairly quickly. But buildings generally last upwards of 50 years. So I think it's very important, as Nick just mentioned, to be thinking about not just having the bare minimum code, but if there is capacity, if it is possible, to see what's going to be important in 50 years, because that's the age of the building.
If I might add, DFCM for 5-10 years, I'm not exactly sure, they have building standards, and they have specified MERV 13 filtrations for non-attainment areas for a long time. So new state buildings should have MERV 13. There's other programs we're all familiar with, like LEED. Almost all LEED certified buildings, including this, I've never seen the mechanical system here, but I can guarantee you this building has MERV 8 pre-filters, MERV 13 or better final filters. So some of those incentivized non-codified programs like LEED have requirements or incentives for filtration, and there's all kinds of lead points for air quality.
He answered it. It was just that the state has a high performance building standard, and if anyone does want contacts with DFCM, who's working on these projects.
First of all, thank you. That was very informative, excellent, thought-provoking presentations. Regarding schools, I know that MERV 13 is now sort of the national standard for health, if you will, and a majority of schools or public buildings still have the rate for lower than MERV 13. And that the ESSER funding, that there is funding available to upgrade systems. I was curious, in Utah, we're seeing schools able to take advantage of that, and if they're actually upgrading their systems and able to implement MERV 13.
Yeah, my understanding of Salt Lake School District is MERV 13. I think Dr. Mendoza has more information on that. I cannot speak for other areas, those federal funds. And the White House actually has a clean air challenge out right now, specifically in light of COVID. And this effort has been elevated, and there's federal money that can be spent smartly on upgrading mechanical systems, trying to avoid, I had that caution. There's a lot of marketing for technologies that are questionable. And in other parts of the country, you see this in the news media, schools have bought into some of this not knowing what we're talking about.
Yes, MERV 13 is now the standard for a Salt Lake City School District. I do know of other schools, specifically those that are going to be impacted by the Mountain View Corridor. One of the schools at least now has MERV 16, based on some of the findings from an air quality study. But as far as I know, only Salt Lake City School District has MERV 13, but other school districts could have it as well.
Okay, well, I'm going to pitch one more question to you, and I know this actually came from someone who we've been kind of speaking with over the months as we developed this, and their question was, what would a resilience checklist look like for like a resident? And I know this is kind of how you're thinking of things, Daniel, is we want to make sure that residents are empowered to do something about that. And then I saw in your presentation, Nick, that you had the example from Montana of what essentially was a resilience checklist. So I'd be curious to know, one, if you, Nick, know of any, just how that campaign, or if that's been effectual, or any thoughts from either speakers on what we could be kind of developing from various entities in our region to help get that messaging out. So very open-ended question, but I'd be curious to know any thoughts you have.
Yes, I'll just follow up on what Nick presented, those action plans. I think that definitely, when we're looking at commercial versus residential, there are substantial differences. For example, when we think about, and I'm just going to do the example of vehicle fleets, for example, one can either have the lowest emission vehicle, which is a Nissan Leaf, for example, or a zero emission electric vehicle, or you can have your giant SUV. So people have a wide range of choices and really wanting to do what do they want to do. Whereas in a commercial building, for example, the whole community, for example, the buildings that are managed by the state, the buildings that are managed by the city, they would have a standard protocol. So what I think is very important is to really bring education to everyone in the community. That's where I'm thinking that in terms of residential, and especially as Nick brought up, if we spend basically one third of our lives in our bedroom, 70% of our lives in our home, then we really need to be thinking about that. But again, the whole panel here, everyone who's present at this event, and many of our colleagues are aware of these challenges. There are many community members that have no idea that this is a completely foreign concept. Even here, even within air quality community, at least 7 years ago, for example, there wasn't that much of a thought in terms of air pollution going inside our buildings. We've always talked about air pollution outside, we've talked about the inversions, but it's very recent that we've started to actually find out what is really coming in. We've been starting to measure that with different sensors. So I think we have to evolve this, but then we have to bring along all our community members. And here in Salt Lake City, we have so much diversity, language diversity, English learning levels, that the more vulnerable populations need to be informed and need to be educated. And I think that that's something that's very important, at least from the residential side.
Yeah, I would add on this communication for residents. I'm a scientist. We are notoriously bad communicators. We need to bring in our behavioral science friends, marketing, communication folks that can really help us distill this in simple terms. I really like those infographics, MERV 13, portable Hepa filters. Here's a link to the YouTube 10-minute video that tells you how to do this, to really distill that information and make it accessible. I think the other comment I wanted to make, and I know everyone in the room is in agreement, outdoor air quality is a tragedy of the commons. We really need to figure that out. We're making great progress and solve this at the source, because it is a bigger burden on underserved communities. It is harder for them to put in portable filtration. It costs money, it costs electricity. They often do not own the buildings they're living in. So we can talk about furnaces, but that is not feasible. So, just backing up, I think we're all in agreement. We need to solve the problem at the source, but we know these are some effective things, and we need to think about how we roll this out to underserved communities. And many of those communities are at increased health susceptibility.
All right, great, thanks again.
So for the remainder of the time, we're going to break into some facilitated group discussions. As I mentioned before, there's going to be one that kind of focuses on policy. There'll be one that focuses on general advocacy and communication and messaging. And then finally, folks who actually have a hand in how our buildings or homes actually get managed. So I'm going to be handling the facility management group. Sophia Nicholas, you can raise your hand. She's going to be doing our communication. And then Debbie, our director, she's going to be handling policy. For now, we'll just go ahead and break into those breakout groups. So thanks very much.